All Manipur Dialysis Patients Association has appealed to the state government to urgently reinstate dialysis treatment facilities under Chief Minister Gi Hakshal Gi Tengbang, that is CMHT, and Pradhan Mantri Jan Arogya Yojana, in short PMJY, warning that over 700 dialysis patients are at immense risk of deteriorating health if the schemes are discontinued. Addressing a joint press conference at the Manipur Press Club today, association members along with dialysis patients expressed grave concern that from 6 November onwards, CMHT and PMJY card holders will be charged for dialysis treatments which were previously covered under the schemes. A patient stated that the schemes have been a lifeline which covers expensive medicines, travel and treatment costs, saying that their suspension will impose unbearable financial strain. It may be noted that the issue came to light after the state government failed to clear dues amounting to over 90 crore rupees, which made CMHT and PMJY impanel hospitals such as Babina Hospital, Sijja Hospitals and Trevi Hospital to begin charging all dialysis patients, even to patient card holders. The association urged the authorities to immediately address the pending payments and restore the dialysis services to prevent a potential medical and humanitarian crisis.
Hafta amada ahumlak tawba yauri marirak tawi waring mathakda hingningi tasingna ko adi hingning basida pasha lawrne harga di akhoi thuna sibi mawong aduna yarga di sarkar akhoi bu nungsibiu